We will be learning about traumatic brain injuries. A traumatic brain injury occurs when an external force causes an intracranial injury affecting brain function. An external force causing a traumatic brain injury may include an object such as a bullet or a piece of skull that goes to the brain tissue, or a blow or jolt to the head or the body. The impairments resulting from a traumatic brain injury may vary depending on the severity of the injury. The impairments may be cognitive, physical, perceptual, behavioral. Damage may be mild or temporary or permanent that results in coma or death. There are different types of brain injuries. For example, a primary injury is when there is an immediate damage to the brain. It is the injury that occurs at the time of the fall, car accident, or gunshot wound. A secondary injury refers to the changes which happen gradually over time as a result of a primary injury. These secondary brain injuries include cellular, chemical, tissue, or blood vessel changes causing further damage to the brain tissue. A traumatic brain injury may be an open or closed injury. A closed traumatic brain injury is when the external force which caused the brain injury did not penetrate the skull. Shaking or rapid forward and backward movements of the brain encapsulated by the bony skull causes damage to the brain tissue, such as bruising, tearing, and damage to the blood vessels. Car accidents, falls, sport injuries, and shaken baby syndrome may cause closed brain injuries. An open or penetrating traumatic brain injury is when an object, such as a bullet, knife, or bone fragment, goes through the skull and the brain tissue. Now let's take a look at our case study. BR is a 24-year-old male. He is a right-handed carpenter. 3 weeks ago, he sustained a severe traumatic brain injury in a motor vehicle accident. When admitted into the ER, his Glasgow Coma Scale was scored 7 out of 15. BR was in a coma and intubated for 6 days. During the coma, he demonstrated decorticate posturing. It is now 3 weeks after the accident, and BR is in the hospital's acquired brain injury unit. Let's look at the investigations found, which is under subjective information in the case study. BR CT scan MRI found damage to the left parietal and frontal lobe. Now let's look under the objective information in the case study. Regarding range of motion, BR has passive range of motion and has increased flexor tone in upper extremities. On the modified Ashworth scale, BR scores 2 out of 5 in bilateral elbow and wrist flexors. Regarding sensation, BR is too distracted to complete sensory tests. Under special tests, BR scored 10 out of 5 on the Glasgow Coma Scale. Regarding his mobility, BR requires moderate assistance times 1 for sitting balance. BR requires moderate assistance times 2 with standing balance. Transfers, he requires moderate assistance times 2. Non-ambulatory, and assistance is needed for wheelchair mobility. His perceptual and cognitive impairments include impaired perception of auditory and visual input. He has difficulties with attention and concentration and has trouble with short-term and long-term memory and displays poor reasoning. He has problems with organization and categorization of verbal material, and decreased language comprehension is noted. Regarding his affect, he exhibits impulsivity, reduced insight, and inappropriate emotional responses. For occupational performance, he requires moderate assistance times 1 for all personal care. Now let's learn about the pathophysiology of a traumatic brain injury. The brain tissue damage that occurs with a traumatic brain injury can be categorized as a primary injury or a secondary injury. A primary injury is when there is immediate damage to the brain. It is the injury that occurs at the time of the fall, car accident, or gunshot wound. A secondary injury refers to the changes occurring gradually over time, following the primary injury. These secondary brain injuries include cellular, chemical, tissue, or blood vessel changes causing further damage to the brain tissue. Let's take a deeper look at primary brain injuries. The immediate damage to the brain caused by an external force may be broken down into 2 types of primary injuries: a focal injury or a diffusal injury. Damage that occurs in one area of the brain is considered a focal injury, and damage to the brain in more than one area is diffusal. It is common to see both types of injuries in patients who have moderate to severe traumatic brain injury. However, 70% of traumatic brain injuries are diffuse axonal injuries.
Let's look at focal brain injuries. Tears in the brain tissue, lacerations, compression and contusion forces result in focal brain damage, skull fracture, localized bruising, contusions at the site of the injury in both closed traumatic brain injury and penetrating traumatic brain injury. At the coop, which is an injury that occurs under the site at which the external force caused injury to the head, neuronal and glial cell death occurs and blood supplies is compromised, which causes hematoma and epidural, subdural, and intercerebral hemorrhage. Around the coop or contracoop, which is the brain damage that occurs at the opposite side of the primary injury as a result of the brain rebounding and hitting the bony skull, a secondary contusion may begin to will determine the presence and level of cognitive complications, changes in behavior, and hemiparesis.
Now let's look at diffuse brain injuries. Diffuse brain injuries is a term used to describe widespread brain damage. It differentiates itself from focal injuries as its main mechanism is a non-contact force of rapid deceleration and acceleration of the head. This may happen as a result of a motor vehicle accident at high speed. The rapid deceleration and acceleration of the head results in shearing and stretching of the brain's nervous tissue. The neuronal axon cells responsible for maintaining and creating myelin, called oligodendrites and blood vasculature, are damaged by the powerful tensile or stretching force. This leads to cerebral edema, ischemic brain damage. It is the extreme damage to the nerve axons located mainly in the subcortical and white matter deep in the brain, which includes the corpus callosum and brain stem, resulting in axon degeneration and disruption of signals in the nervous system that is the hallmark feature of diffuse traumatic brain injury. In the weeks or months following the traumatic brain injury, axonal damage can continue, and this can later result in a secondary pathology of cerebral edema and a hemorrhage. The severity of the traumatic brain injury is determined by the severity of the nerve degeneration and axonal injury.
Secondary brain injuries occur over the hours or years following the primary brain injury. Progression of the physiological, cellular, and biochemical events that occur during the primary injury can result in prolonged or delayed secondary damages. This can last hours or years. Multiple factors may further the development of secondary injuries, such as excitotoxicity, mitochondrial dysfunction, neuroinflammation, apocalyptic cell death, axonal degeneration, and lipid perioxidation.
First, let's look at excitotoxicity. Following a traumatic brain injury, a metabolic process called excitotoxicity can occur within the brain. It involves spontaneous chemical and nerve membrane reactions, which makes a toxic environment leading to death of brain cells on a potentially wide scale within the brain. What makes a brain a toxic environment is the excessive amount of glutamate, which is released by the damaged neurons following trauma. Next is mitochondrial dysfunction. The mitochondria are organelles responsible for maintaining the cell's homeostasis and energy. Following a brain injury, mitochondrial dysfunction may occur. A sequence of events leading to further cellular damage occurs as a result. Next is neuroinflammation, which is inflammation that occurs in the brain or spinal cord, which causes further damage to the brain following injury. Next is apocalyptic cell death of neurons and oligodendrites. Axonal degeneration may occur as well, resulting in communication between axons to become lost.
And last is lipid peroxidation, which leads to cell death. Now we will go over the clinical features general to this condition. It may show physical, behavioral, or cognitive, and sensory signs and symptoms following a traumatic brain injury. Physical signs and symptoms may include a headache, nausea or vomiting, new neurological defects, which may include loss of balance, slurred speech, and spasticity,
or weakness in the extremities or face, double or blurred vision, the pupils may be unequal in size or in dilation, there may be draining of clear fluid from the nose or the ears, and seizures may occur. Cognitive and behavioral signs and symptoms may include a loss of consciousness or change in consciousness lasting anywhere from a few seconds to a few hours. Levels of consciousness may become decreased, mild to profound disturbance in orientation and confusion. There may be difficulty with learning new information, making decisions, and memory. There may be changes in sleep patterns. There may be changes in emotions, such as feelings of frustration, increased anger or aggressiveness, impulsivity, or difficulties in self-control. Changes in perception and sensation may include decreased balance and coordination, vertigo, dizziness, and mild headaches. There may be blurred vision. Visual defects affects about 50% of traumatic brain injury patients. One may have a heightened sensitivity to sound and light, a ringing in ears and other hearing problems, metallic or bad taste in the mouth, mood changes, symptoms of anxiety and depression, fatigue, and drowsiness. After a TBI, a traumatic brain injury, one may experience confusion, dizziness, headache, and fatigue, but these should subside over time. However, emotional symptoms, which may include irritability and frustration, may develop during the recovery period. A traumatic brain injury may be temporary and cause temporary or short-term problems, including problems with how the person thinks, understands, moves, and communicates and acts. Permanent, or it may be permanent. The most severe traumatic brain injuries can cause damage, coma, or death. Let's look at BR's clinical features following his traumatic brain injury. He has increased flexor tone in his upper extremities. A high muscle tone, or spasticity, is a common neurological defect following a severe traumatic brain injury. Motor neurons send signals from the brain to muscles to cause movement. A traumatic brain injury can interrupt the flow of the signals being sent from the brain to the muscles, causing this change in muscle tone. This leads to the following activity limitations. BR does not have the motor control, range of motion, and strength required to hold or grip tools or operate machinery, which is needed for his job as a carpenter, which leads to the participation restrictions. He is unable to work as a carpenter. Another clinical feature BR displays is a cognitive impairment. BR is experiencing cognitive problems after sustaining a traumatic brain injury. He has poor concentration, attention, memory, poor reasoning, and decreased language comprehension. This leads to the following activity limitations: impaired ability to understand and process new information and retrieve old information. He has difficulty with problem solving in order to do tasks such as understanding new information and doing assignments. He has difficulty concentrating or attending to tasks such as reading, writing, and listening to a lecture, which leads to the following participation restrictions. At this time, BR is unable to participate in school and advance in his post-secondary education. Another clinical feature BR displays is impaired perception of auditory and visual input. This leads to the following activity limitations: impaired ability to listen to the television or audiobooks, impaired ability to read text from books or subtitles on the computer or television screen, which results in the following participation restriction. BR will have difficulty participating in his favorite leisure activity, which is to attend his film and book club with his friends. Thank you for listening to our presentation about traumatic brain injuries.